Hello, everyone. We're glad to have you here today with us and glad to be with you on this Friday, August 21st. We're welcoming the Coulee COVID-19 Collaborative. This is our media briefing to share again what's happening with the collaborative, including the metrics and the data and other items. So I'm joined today by Dr. Kevin Fitzgerald, a family physician from Mayo Clinic Health System, and Dr. Todd Kowalski, an infectious disease physician from Gunderson Health System. So glad to have you guys with us today, and we're doing this together. Today we will share with you the latest data and recommendations from our collaborative assessment, and we'll walk through our new web resource, which is live and available right now at www.couleecovid19.org. So that's COULEECOVID19.org, which is again now live and available to you as a resource. So we encourage our media partners and the public to go to this web resource and check it out. We're going to start our comments today with Dr. Fitzgerald and this week's recommendations to the community.
Thank you, Jennifer. As we shared with you last week, the Coulee COVID-19 Collaborative uses the Harvard Global Institute model as a guide for assessing the level of concern with COVID-19 in Crosse County. As you heard us say, while the previous COMPASS risk assessment provided an overall status, the current process will share recommendations without an overall indicator light. So as we looked at the overall numbers this week, based on metric 1, the new case rate, for the week ending August 18th, our new case rate was 7.6 per 100,000 people. The trajectory of the new case rate over the past 7 days is decreasing. Just as a reminder, what we reported last week was a case rate of 10.17. Metric 2 and 3, the new hospitalization rate, regional, and the ability to care for all patients are both in the satisfactory levels. Specifically, the hospital's utilization rate was at 0.73 in the green, and the ability to care for patients was noted as being green for both health systems. When the collaborative looked at the community indicators, which include public health and testing metrics, all but one are in the satisfactory levels as well. Though our testing turnaround time is what we would call in the caution zone, it has been improving. The collaborative forecasts that overall our status is improving in La Crosse County. Given the information from these metrics for La Crosse County, the Coulee COVID-19 Collaborative recommends the following to assure a safe and healthy community. So 7 recommendations. These are very similar to last week. If you have any symptoms consistent with COVID-19, stay home. Also reach out to your local healthcare partners and get tested if you have those symptoms. Again, try to stay away from the general community until you have seen a healthcare provider. Number 2, wear a mask when in public. This includes anything outside of your household. Number 3, keep a 6-foot distance from others outside of your household whenever possible. Number 4, wash hands frequently and avoid touching your face. Number 5, avoid unnecessary travel to places with higher case rates than La Crosse County. This is especially important for families with school-age children. Number 6, limit personal social gatherings to no more than 50 indoors and up to 100 outdoors. This still includes using the masking and physical distancing in those settings. And number 7, minimize mass gatherings in businesses, public buildings, and spaces to up to 50% of the capacity of any particular room. And again, continue to utilize masking and physical distancing in those settings. Or maximize numbers consistent with the social gatherings listed above in number 6. Just as a reminder, the data will be reviewed on a weekly basis by our collaborative, with weekly recommendations being shared to the public. At this time, I'll return things back to Jennifer with some additional updates on the timing of the weekly updates and where the public can look for the data.
Yeah, thank you, Dr. Fitzgerald. Appreciate that, providing those recommendations. So We will be updating the timeline of sharing information. We want that to be quicker each week from the time the data is pulled to the time that we share it with you. So moving forward, starting the week of August 31st, so not changing for next week, but the week of August 31st, the collaborative will meet to review data on Wednesday, and then we'll share recommendations with stakeholders on Wednesday afternoons. And then all information will be updated on the website. Again, the new website address, CouleeCovid19.org, by 3 p.m. on Wednesdays. That will be starting on September 2nd. If there are significant changes, a media release would be shared with partners, and there would be periodic media briefings with the collaborative relating to recommendations as that is needed. We hope that these new metrics really become a tool for the public as we move forward. So in addition to these weekly updates, the public will have continual access to this online resource that we've talked about. Again, this is available right now at CouleeCovid19.org. And I'm going to walk through this web resource with you to show you how the current data appears on the site and where you can find each aspect that we've talked about, so you're familiar with it and how to review it. So you should be able to see my screen at this point, and this is the home screen for the CouleeCovid19.org website. Just as a note that there are two ways to get to this website. So the website address that you see on top is another web link to get to that. But we'll primarily send you to CouleeCovid19.org. It's the same website. So this is the home page that you'll see when you come to this website. The home page describes a little bit about the Coulee COVID-19 Collaborative. So you can look here to learn a little bit more about our collaborative. The second tab, if you see across the top here, it shows different tabs that you can use to navigate this site. So the metrics tab will show you the three primary metrics that we talk about each week. And so the new case rate, which is a 7-day rolling average here, shows up alongside the new hospitalization rate and the COVID care capacity. And again, there's no overall indicator light, but these three metrics will have an indicator light. So you'll be able to identify the thresholds that change the indicator lights underneath each of these. And then you can also hover over each of the indicator lights where it will tell you what the rate is or what the data point is, but it's also shown here for your convenience as well. On this first metrics page, it does also have a graph or a chart that helps you see over time the new case rate. So you can see, and these colors are associated with the thresholds that really go directly back to the Harvard model. So you can see over time where our case rate for new cases is at, and you can hover over any point in time to see where it was at on any particular day. So when you scroll back up, you can then go to the Community Indicators tab. And this tab will show you metrics 4 through 9. And so on this tab, you can see all of these metrics listed, including what the metric is, what the goal is for that week. And the goals will not change with the exception of the daily aim, which is based upon a formula and will be updated each week. And then it also indicates the current status with either a check mark or some sort of indicator to help you see if we are in line with that goal or not. Additionally, a couple more graphs to help you interpret the data if that's helpful to you. This one shows the number of tests resulting by day, a 7-day rolling average in our county, and the percentage of tests that were positive in Crosse County as well. So scrolling back up, then the next tab is the guidance tab. And this is what you just heard Dr. Fitzgerald talk about with regards to the case rate for this particular week. There'll always be a date to identify when this was last updated, the case rate per 100,000, the trajectory, and then of course the recommendations for the week. And then there's just a graphic down below here that we think might help with highlighting the top priority recommendations as well. And then finally at the bottom, some links for more information, such as the Harvard model, the Global Health Institute model that we reference, the list of symptoms so that you know the symptoms to be watching for, and a link relating to face coverings to the CDC. Then the last two tabs are relating to case data. So this is the data that the Crosse County Health Department pulls directly from cases and contact investigations. We have heard that this information has been valuable to our public, so we wanted to continue to keep this available to you. It had not previously been updated for several weeks. It is up to date as of the 18th. You will notice here a slider bar that will help you identify a particular time period. So if you would not want to see the entire time period from when data began on March 18th, you can actually slide this bar over and you can see like the last week or whatever it is you would like to see. And then the case data will update with that particular date range. So that's a nice feature for you to look at. I'll just keep it at the full time period for now, and also show you that you can see in each of these areas like age or race, there is a grand total, which will tell you the total number of cases and information going into those particular data points. And it will also allow you to hover over and see, for example, the percentage of the total cases that are in that particular race. So there's a lot of features on this page that make it interactive. Again, this is not significantly changed from how it has always been prepared for you, with the exception of it being updated. There are also a couple of graphs at the bottom that you can use to reference. And again, those are related specifically to case data. So you're welcome to look at that and play around with the data there. Finally, there's a safe travel tab, and there's some information here about travel. And one of the recommendations you heard us talk about was not going to locations with case rates that are higher than La Crosse County. So this map pulls up for you here and will show you, which locations are considered higher than La Crosse County. So that is helpful. There's a key up here on the top right of the map, and you can see the index county in blue, which is La Crosse County, and you can tell where case rates are higher or lower than La Crosse County. So that is the web resource. Again, that is available at CouleeCovid19.org. So just a couple of reminders based upon that web resource. Again, it shows you the metrics, the community indicators, the recommendations for the week, the case data, safe travel, and just wanting you to know that it really, all of that on that web resource is evidence-based. And we want to provide information for you that can be helpful and is really coming from the best available, most up-to-date evidence. And at this point, I'm going to turn it over to Dr. Todd Kowalski from Gunderson Health System to provide a summary of the collaborative work to date and community interaction before we take questions from our media partners.
Yeah, thank you, Jen. So it seems we're heading in the right direction. I think that's a good place we're at right now. This is really due to the work, and maybe the word I'll use is disciplines that have been used by our community members, those disciplines of physical distancing, hand hygiene, and masking up that have continued to be so very important to the success and the trajectory of where we're going. These are important for personal and health reasons and your friends and family health reasons, but they also are really critically important to help our organizations, our schools, and our businesses continue to reevaluate their operating plans and take steps forward. So I know I sound a little bit like a broken record when we say that, or maybe an iPod on repeat, but the lyrics are so important, and they literally are the things that will change the trajectory of what our community might look like this coming fall and winter. And so that's why we continue to emphasize those things. I have a couple of other quick comments. First, around testing. Our ability to test in our region continues to improve. As Dr. Fitzgerald said, we strongly encourage those with symptoms of COVID-19, even mild symptoms, to reach out and get a test, either through your healthcare system or through one of the community testing events, the next of which I believe is this coming Monday. That helps, again, not only you and your friends and family in terms of their exposures, but it helps us understand the disease activity in the community and helps us to mobilize contact tracing efforts to further limit spread in our area. Finally, I'll say that turnaround time is really in a good place right now, and we're very optimistic that that will continue to improve in the coming weeks. So that really should be, there should be no discouragement from getting a test because of concerns about delayed turnaround time. That's in a good spot right now. Regarding schools, we've heard from a number of parents' concerns locally about children not being able to either participate in sporting or other curricular, co-curricular activities. We would acknowledge that this current state is really not ideal for the health of our children and our kids. But we also need to recognize our collective responsibility and the importance of keeping our children and our school staff safe. And that's really why our collaborative's hope is to be able to provide the science, the data, the most current evidence-based recommendations to schools, parents, families, and businesses so that they can make those well-informed decisions about what is the right decision for them. There was a question last week about, are we seeing increased cases in some of our younger populations? And I think the answer then and now is no, we're really not seeing a trend in that direction. But we do want to recognize and call out that higher education is starting up soon. Universities and colleges in our region will be starting soon. I think Jen's going to maybe speak to some of the efforts that they've been engaged in trying to reinforce those key measures of masking, distancing, and hand hygiene in that cohort of people. With that, I would close a little bit with just a reminder of what the collaborative is and why we're here before. Our top priority, as Jen said, is really to provide, and continues to be, to provide the best scientific, most current and evidence-based information so that we can make the best recommendations for our communities. And that's really where we've been. I have one final plea that's tangentially, but actually more related to COVID than one might think, and that is regarding flu vaccines. As an infectious disease doctor, I always believe in the value and importance of a flu vaccine. But I have to say, this year, there has never been a year when I would more strongly encourage the importance of getting the flu vaccine for you, your families, your friends, and your communities. It's going to be a big deal this year, and so please take those efforts and get vaccinated against the influenza, which we do have a safe and effective vaccine for. Thanks for the opportunity, and I'll turn it back over to Jen for comments.
Yeah, thank you, Dr. Kowalski. So as Dr. Kowalski alluded to, there are a number of partnerships happening with regards to higher education. I'll highlight just a few of those. So first of all, we have partnered with an individual who 11 months of the year is in a student wellness coordinator at UW-La Crosse. And that individual, along with an advisory team of really those that are in the 20 to 29-year-old age range, are conducting focus groups with that age group and surveys to better understand barriers to mask use. And that will be important for us to know in order to help promote in the right way the use of masks in that population. So students also voted on mask designs, and based upon that information, we have ordered 6,000 masks of 3 separate designs and styles to assure that we are providing masks that students will wear. And that distribution will occur in the downtown area, where students often go off campus for activities in the first couple of weekends when students come back to campus. Also, we have a university strike team, which is represented by all 3 of the higher levels of institutions. And those folks, along with the health department and other community partners have been really talking about different preparedness aspects like disease investigation and contact tracing, testing, isolation and quarantine, to assure that the plans that they have are not only evidence-based, but are responsive and adequate, and we're working as a team to learn from each other. So that's been really valuable. We've also partnered with UWL and are working on a partnership with Western as well to support their disease investigation and contact tracing efforts, so that they will provide staff that will be supported by our disease investigation team to assure that they are always up to date on the latest information about how to conduct those investigations, and we can have a really well coordinated effort to assure fast disease investigation and contact tracing for that population. Lastly, I'll just add that the city of La Crosse has been really kind of spearheading a number of bags to be completed and disseminated to students off campus in conjunction with landlords. So higher ed, UWL, and other higher ed institutions, along with the health department, have been putting together resources for that distribution as well. So again, just a few examples of how we're working to sort of decrease the potential for spread and outbreak in those populations when students come back to campus. So just to close here before we take questions, I think the collaborative and all of our community, again, just to reiterate, we want to work together, and this working together and doing the right thing with regards to the recommendations will help our community keep the spread of COVID down. So now we'll open it up for questions from our media partners.
Hi, Jen. Marcus with News 19. So looking at the new safe travel, the map, how do you expect people to look at that and decide whether or not they should leave their home?
Well, when you're thinking about leaving your home, first and foremost, you should be looking at, have you been, do you have any symptoms of COVID? Because if you do, then, our primary recommendation is that you not leave, that you stay home, and that you seek testing with your healthcare provider. If you're going to be traveling, there's a lot of considerations that come into play. How long are you going to be gone? Are you driving? Are you flying? Are you going to be on a cruise? Some of those items some of those mechanisms of travel are much more risky than others. So if you're going to be driving through areas that are at higher case rates than La Crosse County, for example, and you don't stop in those areas, or you have a really good plan if you do stop, that you're wearing your mask and maybe even gloves, and you're washing your hands frequently and taking all of those precautions, then travel can be safe. But if you're going to an area that has a higher case rate than La Crosse County, and you're planning to be there for a while, and you're going to be in the community there, then you may potentially be bringing more risk back to La Crosse County when you return. Likely, although most don't think about it this way, if our case rate here is higher than another area that you're going to, and you might have been exposed and maybe even in an infectious period before you realize it, because once symptoms start, we go back 2 days prior. Just be cautious to know that you might be bringing risk to another area as well. So, this is not black and white, but it is about giving tools to help identify where there is increased risk and where precautions need to be taken.
I guess I would maybe add to that. We understand that many in our community travel for work. They have to commute to certain places. There's even some local counties that may have slightly higher or slightly lower risk. And we understand that people, some of it's necessary and really not preventable. So what we would advise is avoiding unnecessary travel, especially to areas with a higher risk. And really the big message is avoiding areas where there's severe outbreaks. And then when you go to those areas, avoiding environments that would be at higher risk. So avoid large crowds, avoid large gatherings. try not to be places where the lion's share of the people aren't masking and using some of those wise precautions that we're hoping all of those in our community are using consistently to mitigate the risk. Wash your hands, wear your mask, don't touch your face. All of those precautions apply with travel, but minimize the travel as best you can to what's necessary.
So can you explain why people should spend like 30 minutes looking through all of the metrics to decide whether or not to leave their house?
So I'll start and then others can share in, but I think, you know, the metrics and the data are a tool to help provide our community with the information that helps determine risk level. So just remember that it is all about trying to decrease risk, and understanding what the data tells us about COVID in our community is an important way for us to learn about that to help decrease our risk. So I'll let others speak to that as well.
And I guess my comment would be, first of all, hopefully we've created a process that wouldn't take 30 minutes, but not much more than a few minutes in all actuality, to take a look at this site, see where we're at. And then if our collaborative's goal is to give the most up-to-date and informed information to the people in our community and regions, you know, this really allows you to go take a look at a map, see where you're at, see where your destination's at, and make a call in terms of risk. So I think this is yet one more tool to be employed by our populations. But it's all about informed decisions with the best available evidence and data, and that's what this is about.
Hi, this is Mel Meyer with News 8 Now. I'm want to go back to something that you talked a little bit about, the importance of flu. I understand that we're actually at the very beginning of cold season, even if people don't think it is. That end of August is usually considered the start of cold season. Could you just reiterate some of the differences that people might notice in their potentially if they think they might have cold symptoms versus COVID-19 symptoms?
Maybe I'll start with this one. Dr. Fitzgerald can jump in if you'd like, but this is the challenge, right? Because COVID-19 symptoms can be as much as asymptomatic to mild congestion and fevers and malaise to, of course, very severe cases that we see people in the hospital. It's not all, there's nothing that a clinician can do to clearly discriminate between the two, which is one of the real reasons that we say, get a flu shot this year. Have your friends and family get a flu shot this year, because every respiratory illness that we can prevent is an episode where we don't need to be thinking about testing for COVID and doing all of the isolation and important quarantining activities that go around that while we wait on test results. That's the challenge we're heading into this fall and winter season, is sorting through what's COVID, what's colds, what's flu. And that's why more than ever, as we enter the fall, these recommendations, and including to get a flu shot, matter.
Yeah, I agree with everything Dr. Kowalski said. Again, we will have more illness going forward, just on the basis of what we've seen historically per seasons. Again, we have allergy symptoms right now, and some of those are even similar to what you may have with COVID. When in doubt, contact your healthcare provider and get a test. That would be my message. I'd echo what Dr. Kowalski said, that I would like everyone who's appropriate for a flu shot to get a flu shot, so we can minimize that in our community and minimize overall illness.
We have a question from Emily with the La Crosse Tribune, and this is probably for you, Jen. Is there a place on the website where you can view the case count for each day in the past week and the breakdown of age and gender? And can we explain the reasoning behind eliminating daily case counts?
Yeah, so I would really point you to the case data page. That does give you, again, that slider bar opportunity to look at a certain time period, and you can see the breakdown in that regard. But really to just speak to the case data, the case counts being shared daily, moving to the weekly case counts really helps us see that data in in a better context. It's really more accurate to look at it over a time period of more than a day, because various things can come into play with having a lower or a higher case count in a particular day. And that includes testing and when test results come in. So there's a lot of potential variability, and providing that at a weekly level is really more accurate and a better description of what that should tell us, especially as it should change, like, and advise your behavior changes. So I think it really is a better context to help express and show what your behavior changes should be.
So when people call and ask what the daily number is, how does that rate help explain it more specifically than a specific new number?
Maybe
Yeah,
I can
so
help with the context, Jennifer. So when you look at a daily case rate, especially if you stand up a large testing site, for example, what the National Guard may do, or in my family's case, my daughter went to college and they tested a few thousand college students in one day. You may have a real sawtooth pattern to the data based on case rate, and the 7-day average allows to let you know what the real risk is in the community over a longer period of time, and takes away those spikes that really are not, from an epidemiologic standpoint, as informative to the risk of the community.
And just remember that a daily case count and a daily case rate are different things. A rate is a number per 100,000 population, and the new daily case rate is also using that 7-day rolling average, which helps it be a more accurate data point for us to really look at and use to gauge, again, what our recommendations or behavior changes should be.
Hey, Jen, it's Rick at WIZM News. Just sticking with that topic, how accurate is the state data with case counts? I think we're at 1,008. That's what the state says right now, as of yesterday.
Yeah, similarly to when, we put out daily case counts instead of rates, they are fairly accurate, but there can be glitches with the data. That means that, if just one example, if tests are the turnaround time is really slow in a particular location or time period across the state, that number comes in much later than when the actual risk was present in the community. So it's just one data point, and I would argue it isn't the best one. It's not as good as a rate, for example, and especially a daily case rate that is really looking at that 7-day rolling average. But it is nonetheless a number of the tests that have resulted in positive or negative results that particular day. It just isn't. It's a point in time snapshot. It's not an understanding of the trend.
So talking a little bit more about the universities, Viterbo is starting to move back. UWL will be moving back next week. You kind of mentioned how you're working already with the colleges and universities and some of the initiatives that you're doing, including getting more masks to students. Are there any other guidance that you would recommend to students as they're considering coming back and as they make their way back to the area?
Yeah, thanks, Mel. So if I was speaking directly to students, I just want them to understand that, as with the general public, there's a variety of beliefs and understanding about COVID-19 in particular. But my main message would be that if we don't take this seriously and follow the guidance that we've asked all of our public members to follow, including masking and physical distancing, then we have the opportunity to increase risk for our whole community. It isn't just about one person or one group of friends or even one campus. It is about the second and third order effects that we know can happen in relation to individuals that may have the disease, may be able to spread it prior to knowing. And then if that spread is getting to locations where they work or where they have been in the community, that really does impact the whole community. And it isn't just about one person. So just remembering that our behaviors can impact others, and that taking this seriously by following recommendations, we can't stress the importance of that enough.
And what an opportunity to be a part of something bigger than yourself as you go through the educational process and growth that happens in higher ed. And so that really is what this is about, is being a part of something bigger than yourself, and serving your community in a way that really makes a difference.
Yeah, and I'll just come back and say that being a part of something bigger than yourself, like you indicate, Dr. Kowalski, is exactly what's behind the engagement project with the 20 to 29-year-olds, and incorporating their voices into, what do you want your mask to look like? Make this something that you're willing to wear. And also, we're really working with an individual on the UWL campus who's a business major who has a nonprofit and is helping to order these masks and to distribute them. So there are really great folks in this population who are engaged already and are working to spread that message. And so I agree, be a part of something bigger than yourself. Thank you for that.
Going back to flu shots for a second, when is someone eligible to get it? So if you got your flu shot maybe mid-October last year, do they have to wait till mid-October, or can they go ahead and get it right now to be good for the season?
Yeah, so I can take that one. Dr. Kowalski and I have both been doing this long enough that we remember when there were stories around waiting for your flu shot to November or December, so it lasts through the whole season. And we've seen studies that show that whether you get your flu shot in September or October or December or January, your immunity lasts through the whole season. So there's really no reason to wait for later in the season once flu shots are available. I think what you're going to see both from the county side of things and in both health systems is that we're going to have a lot of people wanting flu shots this year. There's going to be a lot of demand, and we don't want to have all that demand show up all at once to get people immunizations when it's available. So I would recommend people in the community talk to their healthcare partners, talk to their providers. If you go to Walgreens or if you go to the county for your flu shots, try to do that as soon as you can when they're available, so we can get those immunizations rolling.
Do we worry about students coming back at colleges and being in dorms? And, even if they're one person per dorm room, the idea that they're not going to go to their friend's dorm is kind of ridiculous. And we've seen spikes in other colleges around the country.
Yeah, I worry about that. I, again, just dropped my daughter off in Omaha to go to college. And really 4 days after the students arrived, there was some positive students, and the contacts of those positive students, because they weren't wearing masks and were within 6 feet of those positive people, had to go into quarantine for 2 weeks. So they're in their dorm rooms, not being able to leave their dorm room for 2 weeks in what would very much seem like house arrest. So here's what I told my daughter. She has spent a significant amount of time in my basement instead of being at college over the last 6 months. I think she would have much rather been in college over the past 6 months with her friends. And when I dropped her off, I said, if you would like to stay here, follow the rules. Wear your mask. Avoid large groups. Don't go to large gatherings where most people aren't wearing masks. If you're going to visit your friends in their dorm rooms, wear a mask. Keep your distance. Clearly don't share glasses. You have to follow some of the guidelines and rules that may seem a little bit overly strict for people of that age group, but really is going to allow you to stay in school instead of coming back to dad's basement.
I would just follow up to that. Jen, have you guys given any guidance to any places like bars, restaurants, places that college students might frequent as they're coming back to the area wanting to socialize? Have you worked with them at all, laid down any ground rules about what could or couldn't happen if we start to see a spike in cases?
Yeah, even a month ago, we had a conversation with the president of the local and the state tavern league. We've also connected with the restaurant association, and so just to tell you as one example, we are going to be launching, I think maybe even Sunday, a radio ad campaign with the Tavern League and the health department working together to pass that message on, that if you want to enjoy your favorite bar or restaurant, that you really should be bringing your mask with you. And if you don't, then those establishments will have a mask available for you. And the Tavern League has purchased those masks for their members to have available, so that all you need to do is walk in and ask if you can have a mask, and they will provide one to you. So again, a lot of different aspects we've worked on to try to decrease the chances that we might have a larger than we want outbreak. We don't want any outbreaks this fall with higher ed or anywhere. And so again, I think that's a critical partnership. And we know that, those locations are really, they're really doing what they can to assure that those environments are safe. But sometimes the nature of the activities that occur in those establishments are inherently risky. So that's why, it is a supply and demand question. It's not just on, those that own those establishments. It's also about, the customer base and them taking actions to do the right thing as well. It's really a team effort, as with every part of COVID and reducing risk.
How accurate is the recent saliva test, and could we see its implementation here?
Maybe Todd, you could take that one.
Yeah, well, so there's actually been a number of saliva tests. So there's one that's been in the news a lot lately, the one from Yale that the NBA has been using, and that looks like a pretty good test, a very good test. But there's been a lot of other saliva tests too. There's just been an incredible flurry of research and test development, all with their own little nuances and specifics. So I think there's a lot of interest in the Yale test, and then now it'll go through that same process that all the other testing has, and that is figuring out what does it take to get it mass produced, what does it take to get it produced on a local level. My understanding is there's going to be some open sourcing for that test, and so it might be a little bit more available than centralized testing kits have been in the past. So I think we're always looking for ways to enhance testing capacity, and this will be no different.
I agree with that. And I think the other thing to keep in mind, part of what we're really working on locally and really nationwide is capacity for testing. Because in a perfect world, when Ms. Rybalski and her team goes to do contact tracing, if you have people with a significant exposure, we could do additional testing for asymptomatic people to look and see if there was spread. The more platforms we have to do testing, the less likely you're to run into shortages of reagents and testing supplies and those types of things. So I predict that we're going to do saliva testing and some other things in the very near future, locally and in other places nationally, and that'll help us with our overall capacity.
My last question is just about that possible reinfection. Again, very possible. You guys were still trying to determine with that case if it was indeed a reinfection. The person had tested positive months ago and then potentially became sick again. So is there any update with that, Jen?
No, I would say there is not an update on that. I think we have spoken already in the past about what we know about that case and what we know about reinfections in general. Thanks, Mel.
Yeah, and I guess I would just to follow up with that, it just like was said last week, there's really been no proven cases of reinfection thus far. Dr. Kowalski spoke to it very well last week that when someone has had COVID, there's still parts of the virus that can be left that turn test positive. Just like the analogy of a snake in a snake skin, that snake skin may be left there that turns the test positive. So it's more of a persistence of the previous infection than a reinfection.
we've seen one recent report from the World Health Organization about people delaying dentist visits if they can. Would you say it's safe to go back to the dentist right now?
Yeah, I think similar to healthcare, dental care, if you delay too long, will have consequences in the future. I think if the dental offices are using precautions similar to what we're doing in the medical healthcare side of things, it would be safe to go back to see your dentist. I can tell you personally, I have seen my dentist for my regular check since the COVID crisis, and they handled it quite well and did a very good job, and everything was clean and safe. So as long as they're following the guidelines and protocols, I would say it's safe to go back to see your dental care.
So oral health is a very important feature of overall healthcare, and if delayed, it will cause issues down the road. So I think it is important, just as in every other aspect, that things be done safely, but it's also important that care is rendered so that we don't end up with future issues that could have been avoided. My little girl also went to the dentist recently, and I'm happy to report she's brushing much more often because of that. So I think that's both where Dr. Fitzgerald and I would stand. It's an important thing for your health.
Agreed. Yeah, and I think that also dovetails to routine medical care. Both health systems are open. We are open for business to see people for illness and for routine medical care. Please don't delay that. There can be consequences from that. So I would go back to your routine when it comes to dental and medical care.
Getting back to the collaborative page, the guidance page of that, are these things ever going to change? I mean, wear a mask, 6 foot distance, avoid unnecessary travel. Maybe that'll change to don't travel at all if we had like a crazy surge. But I mean, this is going to be pretty standard for quite some time, isn't it?
I think while it may look similar, we will make adjustments week to week. And particularly if we start to have a surge, for example, the numbers around, social gatherings and mass gatherings will change. So, I do think it would be important to look at those each week, and we'll notify the public about that each week. But just because it looks similar doesn't mean it is the same. So I do think that those nuances are really important to be aware of, because they will help to decrease the spread of COVID in the event that we have more COVID in our community than we do right now. We would then potentially decrease or change the numbers associated with some of those recommendations.
I'm not seeing any other media questions today.
Okay, well, I'll just say that on behalf of the collaborative and really a partnership with stakeholders as well, really very thankful to serve you and hoping that the information that we're providing is helpful, and appreciate our media partners and all of the questions today, and hope you have a safe and healthy weekend and week. Thank you.